All right. Hello, everyone. Welcome to today's webinar, Election 2024, What's at Stake for Health Equity and How to Protect It. I'm Jacqueline Dalton, Director of the Health Equity Community Collaborative at Health Leads, and I want to give a special shout out to our friends at HealthBegins for partnering with us today to make this important conversation happen. Before we jump in, I want to take a moment again to just thank each of you for joining us today. I know it's a busy time for everyone with school starting back and weather events and all the things that are happening around our country. So the fact that you have taken the time out today to be here with us really speaks volumes, and it also just highlights dedication that we all have in advancing health equity together. So especially at such a pivotal moment, right, in our nation's history. So, trust me, you have made the right decision. You are in the right place. We have a great slate of speakers here today, and we'll have many great insights for you today, as well as even action steps to share throughout our webinar. So just a few housekeeping items before we begin. Yes, this session is being recorded. Please tell those who join us late and ask in the chat. We will be sending everyone a replay right to your inbox in case you miss anything or have to jump off early for another meeting or something else. We also encourage you to submit your questions throughout the event using the Zoom Q&A box at the bottom of your screen. Also, feel free to share your thoughts, resources, any brilliant or pressing ideas that come up throughout the call. We are all here to learn from one another, and we definitely just welcome you to use that chat feature. As a matter of fact, as some of you are already doing, we welcome you to introduce yourself right now using the chat. Tell us your name, maybe your pronouns or organization, where you're joining us from. If you're feeling a little bit out of the box or a little fun today, you might even throw an emoji. Tell us how you're feeling today. That's something that when I was on a webinar last week, I think Community Catalyst did that, and it was pretty fun. So let us know how you're feeling today using maybe your favorite emoji or just an emoji that speaks to you. All right. And as you're doing that, you can also feel free to use the closed caption option, which is available to you. You can click the CC icon at the bottom of the screen to enable closed captioning. And so that is available if you like to use that feature. And then last, if at the end of this webinar, actually, we'll launch a quick poll, a survey poll at the end of the session. So please take a moment if you are with us at the end of the session to share your thoughts on how to, as well as any thoughts for future sessions and that sort of thing. You'll also see another evaluation for the overall webinar pop up on your screen after you close out and leave the webinar today. So that's also another opportunity to just share some feedback with us, brief feedback on the webinar. All right. So now let me just quickly walk you through our goals for today and our speaker lineup. So our goals for today, we want to share with everyone that we want to hope that we're learning about healthcare policy differences. There's an important event that's coming up in almost in a month, right? And I'm sure that everyone knows what that event is. And so we're going to be talking about our presidential candidates' platforms and what are the implications for health equity. We're going to discuss emerging health challenges, health equity challenges at the state and local level, and explore how the election might impact these challenges. And then lastly, we want to share some concrete and collective opportunities for you to get involved, to share with your community, to help you all navigate and even respond to what might be in stake or the outcomes of the election as it relates to health equity. All right. And as I mentioned, you are in for a treat. Hopefully you've already seen and know who we have talking today, but I'm going to go through just a brief introduction for a few leading health equity voices that we have today. So we do have Daniel Dawes, Senior Vice President of Global Health and Founding Dean of the School of Global Health at Meharry Medical College. We have Samantha Artiga, Vice President and Director of the Racial Equity and Health Policy Program at Kaiser Family Foundation. We have Anthony Wright, Executive Director at Families USA. And moderating our conversation today, a face who is no stranger to both HealthBegins webinars and Health Leads, the Health Equity Community Collaborative, Dr. Rishi Manchanda, CEO of HealthBegins. So with that, I'm going to go ahead and hand it over to you, Rishi.
Jacqueline, thank you so much. Thank you, everybody at Health Leads, everyone who's part of the wonderful Health Equity Community Collaborative, and of course, my colleagues at HealthBegins. And all of you for joining today. I'm Rishi Manchanda, CEO at HealthBegins, and it's a distinct pleasure and honor to be a moderator for our fireside chat, our panel conversation today. I wanted to spend a couple minutes on level setting as we now, and then we'll jump right into getting some input, insights, and kind of recommendations from our esteemed panelists. So for level setting, I think as all of you who've registered for this webinar probably appreciate, and part of the reason you signed up here is because we all recognize that there's a lot of noise when it comes to the election. There's a lot of obviously conversations that are happening, and sometimes that noise and conversations might seem deafening. Sometimes it might seem like we need to tune them out because of the nature of dialogue about the election, especially the presidential election. But we know that there are critical signals in that noise that we have to pay attention to, especially for health equity. From the Oval Office to state legislatures, to federal agencies, to what's happening in the courtrooms at the national and local level, we know that this election stands to powerfully affect our progress towards health equity and justice. And that means that we have an opportunity and an urgent need to define what's at stake for health equity and to pursue it. To do this, let's first define health equity itself. Health equity, as we know, is not just about closing disparities between subpopulations. That's incredibly necessary and important, but health equity is also about removing the injustices that cause harm in the first place. In practice, we know equity is both a magnifying glass and a mirror. It helps us see otherwise hidden harms and reveals practices and systems and structures that cause harm. The truth is that health equity travels not only through healthcare, as we understand this from a justice perspective, but through other sectors, food systems, education, housing, and even more upstream through courts and laws and public budgets and policies, and even obscure administrative departments and agencies. In this webinar, our expert panelists today, Samantha, Anthony, and Daniel, will explain the implications of these policy challenges and some threats to health equity, as well as policy opportunities to advance health equity. And I think because of their individual and collective experience and wisdom here, we know that we're going to be illuminated about how the upcoming election could affect these opportunities and these threats. We're also going to outline within this dialogue ways to get involved, ways to get mobilized, ways to do a little bit extra to be able to, as a collective, help navigate and respond to what's at stake. So let's go ahead and jump in to today's dialogue with that in mind, and I'll invite us to bring all of our panelists on camera here, and we will jump right into our fireside chat. So first, Samantha, Daniel, and Anthony, welcome. Thank you so much. I believe you're all unmuted. Let's jump right in with the first kind of question to get a dialogue going. The first question really is about what's at stake. What are the two or three emerging health equity challenges that you're seeing at the federal, state, or local level? And to kick us off here, let's start, Samantha, with you, and then we'll go to Daniel and Anthony.
So first of all, I just want to thank you all for including me in this conversation. This is a great event. I'm glad that we're putting attention on these issues, and I'm really honored to be joining my colleagues for this discussion. I want to actually start by picking up on some of your intro comments. I think we're going to focus a lot on some of the policy distinctions between the presidential candidates, but I think it's also important to recognize some of the larger differences in just their stances on the existence and impacts of structural racism and prioritization of health equity. So if we look at the record of the Biden-Harris administration, immediately at the outset, there was the identification of racial equity as a key strategic priority across all of federal government and a series of executive orders to that end. In contrast, if we look at the record of former President Trump, we see that he issued an executive order combating race and sex stereotyping, which basically prohibited training at the federal level on concepts related to sexism and racism. So I think it's important to level set with kind of those overarching conceptual differences. In terms of policy differences, I'd love to point folks to a resource we have available on our website at KFF. It's called our Candidate Tracker, and it really provides side-by-side analysis of some of the key differences between the presidential candidates across an array of different health policy areas. There are three that I want to pick up on today that I think are going to be particularly important related to what happens to health equity going forward, and where I think there are large differences in approaches of the candidates. And so the first is really related to health coverage. And if we look back at former President Trump's record, as well as his recent proposals, those really included plans to repeal or weaken the ACA, cap and reduce Medicaid financing, restrict Medicaid eligibility, all really with an overarching goal of reducing federal spending on those programs. And while those proposals would reduce federal spending, the trade-off there is, of course, higher out-of-pocket costs for people, more uninsured, and greater restrictions in Medicaid. On the other hand, the Biden-Harris administration proposals have generally focused on efforts to protect and strengthen Medicaid in the Affordable Care Act. So by expanding coverage, bolstering coverage, making it more continuous over time, which reduces the number of uninsured and expands access to health care. If we look back at the impact of the ACA, including the Medicaid expansion, it has led to large gains in coverage, which have helped to narrow longstanding disparities in health coverage, although there's still gaps and room for improvement in that area. The second area I want to highlight is reproductive and maternal health. Both candidates have taken steps focused on improving maternal health. If we look at former President Trump, there were actions to fund maternal mortality review committees, some actions focused on addressing substance use among pregnant and postpartum people. On the Harris side, under the administration, we've seen the extension of Medicaid coverage for 1 year postpartum as an option, which many states have taken up, a new blueprint on maternal health. But then if we get to the issue of abortion, which obviously has been a huge area of focus, we see there are vast distinctions. Former President Trump has taken credit for the overturning of Roe v. Wade by the appointing of the Supreme Court justices. Most recently, he said that he'd leave abortion up to the states, which would allow the bans that are in place to stay in effect. On the other side, Vice President Harris has been a very strong advocate for reproductive rights, supports the right to choose, opposes efforts to restrict abortion, and has backed measures to restore Roe v. Wade. We know from our analysis that the potential impact of those state restrictions on abortion could widen the already existing large disparities in maternal health. The last area I want to touch on is immigrant health and well-being, which is another area where we see really wide differences in approaches and policies. During his term, former President Trump took a number of restrictive actions focused on immigrants, including some that were related to health coverage, but also just created a broader climate of increased fear and uncertainty among immigrants due to a lot of the rhetoric, which we are continuing to see now in the campaign. And our research showed that that rhetoric and that fear really made immigrants much more fearful about accessing healthcare for themselves and their families, including their children who are often US born. So that does have real health impacts. On the other side, we've seen the Biden-Harris administration rescind some of the policies that the Trump administration implemented, really try and reestablish trust among immigrant communities. But once you create that fear and uncertainty, it is really hard to undo that, and it takes years. So, you know, that's another area where I think there are large distinctions that have real impacts, and we're seeing some of that play out in a lot of what's on the campaign trail today. There are more, but I'm going to stop there. I know my colleagues are going to have additional areas that they want to touch on.
Samantha, thank you. You know, and Daniel, maybe as we transition to you and think about what are three emerging health equity challenges at the federal, state, or local level. We've heard from Samantha about Medicaid, maternal and reproductive health, and immigrant health and well-being. Welcome your thoughts, Daniel, as well.
Well, Brigitte, thank you so much. And of course, I am delighted to join you all today. And I'll build upon, I think, what Samantha has articulated by aligning what I see on three additional fronts, but also want to touch on former President Trump and Vice President Harris. So, from the Oval Office to state legislators and from federal agencies to our courtrooms, we know that this election has the power to either build upon or damage generations of hard-won progress towards health equity. And we know that it has the ability to impact the lives of over half of the US population that has at least one chronic condition, right? And let's not even talk about marginalized groups, which have disproportionate outcomes when it comes to health status. So in this upcoming election, for me, what I think we'll see is continue to see even more decisions made that could change the landscape of health equity for generations. If you follow the judicial branch of government, it's been hailed as the sleepy branch of government for so long. And yet we know that the sleepy branch has woken up over the last several years, and it did so in 2009. That was the period when we saw more hyper-partisan decisions coming out of the court, whereas before we had seen a large number of unanimous decisions coming out of the court. So on that front, over the last 75 years, the Supreme Court issued very few polarized decisions until around 2010, when we saw them, of course, issuing these more polarized cases. And of course, we know that was around the election of President Obama. Wanting to build upon what Samantha says, from the idea of former President Trump's ongoing threats to dismantle the Affordable Care Act. This is the most comprehensive and reticulated health equity policy ever created at the federal level. To his threats to cut Medicaid funding. We know that these can significantly reduce access to critical health insurance programs, disproportionately harming marginalized groups. We know that his policies, including his proposals to block grant and restrict Medicaid eligibility, or increase verification requirements and reduce essential health benefits that were provided or are provided under Obamacare. Those would limit access to affordable care, and they would significantly worsen health disparities, which in a study that we did at the Meharry School of Global Health is estimating that the cost would be this year alone $477.5 billion. And we know that it is expected to more than double to approximately $1 trillion in the next 6 years. So by 2030. We also know that his record, to me in particular, it suggests continued retrenchment or regression of policies that have expanded health rights or access to health protective and health sustaining resources that enable us to prevent or treat chronic diseases, and public health threats that we know disproportionately impact lower socioeconomic status individuals, from HIV PrEP to mental health resources to gun violence, among others. So that's one take. In contrast, when you look at Vice President Harris's track record and her proposals, they demonstrate an explicit and a full commitment to prioritizing and actualizing health equity and increasing access to healthcare on the front end, as well as abortion and contraceptive coverage, reducing prescription drug costs, eliminating medical debt, addressing racial disparities, in particular in maternal health, right, and in women's health, and then mental health, population health, LGBTQ plus care, the list goes on. So for me, her efforts to strengthen Medicaid, support reproductive rights, as Samantha mentioned, or prioritize health equity explicitly, and address the social determinants of health, aim to ensure continued federal efforts to address those issues that have been denying these population groups the opportunity to reach their full health potential. So with that, I just want to quickly, I know I'm verbose sometimes, Rishi, so I apologize, but I do want to quickly just mention the anti-DEI movement and those initiatives. I think at the state level, we're witnessing laws like those passed in Texas, SB 17, that prevents public funds from being used to attend conferences that address DEI issues, right, from really pushing and moving forward with that agenda. And then we're also seeing, though, this movement to broadly interpreting these new laws that have been executed and signed into law, where folks are now so scared to address the social determinants of health. I was in Texas, and I couldn't believe that folks said, Daniel, you're talking about social determinants of health. You're not allowed to do that here in Texas. And I said, where does it say that in the law? It doesn't. But that is how far we've come, where folks are so scared, they are now broadly interpreting many of these provisions. And according to the Chronicle of Higher Education, which is tracking DEI legislation, as of July of this year, we know that state lawmakers have introduced at least 39 bills that are meant to eliminate and restrict higher education's DEI programs. And we know that when you look at them, they are extremely sweeping, but it's also a bipartisan issue. You know, before we forget, even in Kansas, a new law, HB 2105, which a Democratic governor allowed to pass without her signature, prohibits public colleges from hiring new employees or admitting students on the condition that they promote DEI. It's pretty interesting. And then one last piece that I want to mention, because this is so critical, especially for those of us who are health equity research. We know that there are congressional attempts right now through the labor HHS spending bill, through the appropriations mechanisms, to insert riders that would propose the elimination of key agencies, the Agency for Healthcare Research and Quality, riders that would eliminate 3 health workforce diversity mentorship and pathway programs that have been critical to diversifying the health workforce. The Centers of Excellence program, the Health Career Opportunities program, HCOP, the Nursing Workforce Diversity program, you name it. And in addition to that, we're also seeing, and this is what makes me very nervous, an attack on the 3 main institutes at NIH, the National Institute on Minority Health and Health Disparities, the National Institute on Nursing Research, and the National Institute on Mental Health, which are the 3 institutes that fund the majority of health disparities research in this country. So we really, really, really need to take and pay attention to what is happening on that front, in addition to what we see happening where folks are now trying to utilize the ACA to prevent health equity programs such as those at the Cleveland Clinic and so forth. So I'll stop there, Rishi, but I hope that sums up my 3 areas of areas that I think are challenging.
Yeah, absolutely, Daniel. Thank you for that. And I think, whether it's the specific kind of policy challenges or even threats that you enumerated, as well as the chilling effect, I just want to appreciate you calling out the chilling effect that is a very real and tangible thing in many parts of the country right now, even as people interpret policies that aren't directly under attack or threatened right now. I think it's a really salient point. Anthony, last but not least, I want to go around the horn here and get your thoughts about the 3 emerging health equity challenges that you see at the federal, state, or local level.
Yeah, thank you, Rishi, and thank you, everybody, for having me. Just to introduce myself, I'm Anthony Wright. I'm the new Executive Director of Families USA, the national consumer advocacy group on healthcare issues, working for quality, affordable, equitable healthcare for all Americans. I come to this work after 25 years working at the state level in New Jersey, and for the last 22 in California. And also as a kid who was born and bred in the Bronx, son of an immigrant mom from Ecuador, and who was uninsured for part of his childhood, and remembers the stresses of having a big hospital bill when I had appendicitis, and what that did to the family, or trying to navigate my ailing parents through the healthcare system in the Bronx. And I think when I think about what's at stake at this election, I think about it at multiple levels, right? I think Samantha and Daniel just talked about just all the different ways. It's hard to overstate how much the election matters with regard to the judicial system, with regard to all the agencies, with regard to all these decisions that are made in different ways in healthcare and in all these other ways. That's why I think actually the attention that has gone on to Project 2025 has been actually important, because it recognizes that it's not just one guy or one woman. It is a whole host of people who will be in all sorts of different administrative roles, making a variety of decisions, and they have plans that go well beyond what the campaign actually focuses on in any given moment. And I think Samantha and Daniel highlighted that. And I know that for some of us, we don't, but I don't think we actually have to talk about Project 2025 that much, because KFF has been particularly great about highlighting the fact that this is a unique election where we haven't really had one in a very long time where we had two candidates that both have federal executive experience. And so it's not about their promises, it's about their past. And they both have records, real records that you can point to. And so, and regardless of what they say in the future, the past is what may be prologue. And so you can talk about that in a very specific way. And so for those of you, I know that for some folks on this call, there's C3 and C4, and what can you say and what you can't. There is actually a lot of freedom to just talk about what happened in the past. That is a fact. That is that is not something that you have to then get into, like, oh, is what a candidate says, whatever. So just in that spirit, I'll just highlight some of a handful of things that are sort of the big ticket campaign level voter pieces, like access to abortion and reproductive health, like the fate of the ACA, like affordability assistance where people can get help with their coverage, and frankly, the help that people need with the cost of coverage, whether it's with prescription drugs or hospitals or anything else. And those are things that I think have broad interest, but have particular equity implications, because we all know that the folks that will be most directly impacted are communities of color, low income, people who will be disproportionately impacted. And then there's another set of issues that are specific attacks or specific risks to specific communities. We mentioned immigrant health. I would also mention LGBTQ community and others. So just to go into those in specific, I mean, obviously, one of the issues that have been most talked about is about abortion and reproductive health. And since the fall of Roe versus Wade, we've had state abortion bans that have blocked 15 million women of color out of important and necessary reproductive care, including 6.7 million Latinas and 6 million Black women. This year, I think it's very important to recognize that this is not just a presidential election. This is up and down the ballot in terms of governors and state legislatures and ballot measures. And this year, voters in 10 states will have the opportunity to protect abortion and reproductive health access. And so I think that's a really important marker for us to focus on and have attention to. And again, it's also not just abortion care, it's the range of reproductive health choices, including there's been more attention on fertility treatments, but I think the range of things, and especially at a time when we have such a maternal mortality crisis and such wide disparities in maternal mortality, especially with regard to Black women, we really need to have that full set of reproductive and women's health available to everybody. In terms of the Affordable Care Act, I think it's been stated that very much is at stake. We know that just looking at the past, even though some people might have different recollections, in 2017 there was a very concerted effort of over 60 votes leading up to that to repeal the Affordable Care Act, and it was just one vote. I don't know how many more McCains there are to buck party if that proposal were to come up, and that's the protections for people with pre-existing conditions, but it's also a host of other both coverage expansions in Medicaid, affordability assistance in the marketplaces. And I do want to highlight that as well, because one of the things that particularly at risk if nothing is done is the additional tax credits that are available for people to afford coverage. Right now, we actually have a cap that nobody has to spend more than 8.5% of their income on coverage. It is worth hundreds, or in some cases thousands of dollars to people to better afford their coverage and make their budgetary ends meet. That expires next year, and so there is a real choice by who is elected about whether that cap and that commitment to keep healthcare affordable continues, or whether that is expired, and that would spike premiums by, on average, $800 a year, but for many more, thousands of dollars. And again, this is particularly impactful in those states that have not expanded Medicaid, and particularly impactful on communities of color, especially in those states. So I think that's another piece. And then on the issue of healthcare costs generally, the issue of whether it's prescription drug costs and the ability for Medicare to negotiate for the best possible price, or the issue of trying to deal with the rising cost of healthcare in general with regard to hospital prices. Medical debt is a huge issue that people are experiencing. Vice President Harris has done just even earlier this week announced a series of efforts to try to deal with medical debt. And again, looking at the equity issues, 1/3 of Americans have medical debt, but that's 1/2 of Black and Brown communities. And so we really need to, again, are we going to go forward with that, both to deal with the root causes of medical debt, but also with the efforts to try to at least provide relief, or as in the case of the administration to, this week, making further steps to remove medical debt on people's credit scores, so it doesn't also have a redounding of impact on their finances, on the ability to get a home and ability to participate in the economy. Those are all incredibly important. I'll just end on that while all of these broad-based attacks are, again, very concerning, there are specific attacks on specific communities. Samantha did a great job of talking about the impacts on the immigrant community. I was proud in my previous hat to have done the work to expand Medicaid to all, regardless of immigration status, and a number of states are doing that. That will be harder in an environment, if in a federal environment that will try to prevent that. It will also be and they may seek to undo some things that the Biden administration has done, like, for example, expanding the opening up access to this to affordability assistance for the DACA and other populations in the marketplaces. And then I would also say another population that I know that has been felt attacked in the last several years has been LGBTQ community. And again, another piece of the Affordable Care Act was Section 1557 non-discrimination protections. And the Trump administration actually tried to turn those protections against the LGBT community by using that as by using basically allowing those with a religious reason to allow them to discriminate. The Biden administration reverse that, but we could see a going back and forth in that. So that's just an example, one thing of many that we really need to be concerned with in this election, and gives you a flavor of, again, as we say here at Families USA, our healthcare is on the ballot and we should act as such.
Anthony, thank you. Daniel, Samantha, likewise. Clearly, a really detailed kind of list of what's at stake. Many of the things that are at stake here, from whether, Samantha, what you mentioned in terms of Medicaid, expansion of coverage, even Medicaid benefits, maternal and reproductive health, immigrant health and well-being. Daniel, the extensive list that you added to describing Supreme Court polarization. We're going to come back to that issue, I know, in terms of what's at stake in terms of the judicial system, the ACA, Anthony, as you also underscored as well. The investments in social determinants, the upstream kind of elements as well that's at stake, and of course, specific kind of communities that are particularly vulnerable right now, including through the lens of reproductive justice, access to reproductive care, immigrant communities, LGBTQ communities, et cetera, not to mention racially minoritized communities. So, I think this really provides a lot of folks with, who are listening in today a better understanding of what's at stake. Before I pivot to the next kind of question about the implications, as we try to connect the implications of these challenges for what it means for health equity practitioners, health equity advocates who are here today, with us. I'm curious if you could, first, everybody who's listening in, for those who've already done this, thank you. If you have questions, put them in the Q&A. The chat is great, but the Q&A is even better. So please put your questions into the Q&A. We're already seeing a good number of questions come up. But let's pivot now to this, and maybe Anthony, I'll ask, we'll turn this around, and Anthony, ask you to go first, and then go to Samantha and Daniel. What are some of the implications here, right, for these challenges, in particular for health equity practitioners and advocates to be aware of? I'm mindful also, by the way, of something that each of you have kind of alluded to and has come up in the chat and the Q&A, which is that it can be overwhelming. It can also be exhausting right now when we're considering the challenges. And so with a particular mind to the energy and the kind of the psychological state for a lot of health equity practitioners and advocates, curious if you could start us off by talking about the implications of these challenges and why these are so important for practitioners of health equity. Anthony, I'll start with you.
Yeah, I mean, I would start with, I think, well, you first have to start with money. At the end of the day, the federal government is a major source of funds for our healthcare system overall, uh, and for a lot of the projects that those of us who are engaged in health equity depend on. And sometimes it's a direct line of source. Sometimes it's just based through like just that we're all based on a foundation of whether it's, you know, for some community clinics or public hospitals or others, you know, a foundation of funding of the Medicaid program or of other sources of funding. And if those key, not just that federal framework, but financing is under attack, then, you know, then there will be a question of what gets cut and what gets cut directly. And it could be direct services, it could be efforts at public health, it could be efforts to try to ameliorate some of these health disparities directly. And so, and again, I think that frankly, that is at stake, not just if we have the trifecta on one side or another, but actually in the issue of split government, right? Because there will be debates about the deficit of the federal government. There will be debates about a debt ceiling. And that will be opportunity for leverage to figure out should there be what kind of cuts there should be to the ACA, Medicaid, Medicare, and our public health infrastructure in general. So I think that's one set of concerns and issues for engagement for health equity practitioners. I would say that the second one, and I think Daniel will probably talk more about this, is the direct attack on just the notion of dealing with health equity and dealing with disparities. There is a growing pushback, anti-DEI, anti-woke, et cetera, to just to attack what I think many of us believe is the notion of targeted universalism, the notion that, well, we need to both have universal solutions because that's the only way that we deal with the power structures and imbalances in our system overall. But we also need to have targeted solutions for targeted communities because specific communities have specific problems that need specific solutions. And there is a pushback against anything that is that mentions race or mentions a specific community. And we see that with, you know, litigation against the Cleveland Clinic. We see that, frankly, even in blue states like California, where there is a reticence to perhaps do the program that's targeted at, you know, a specific racial or ethnic disparity because of you know, concerns about litigation or anything else. And I think if we had the federal government with the tools and powers of the federal government, using that power, that could be have a chilling effect, if not much worse, even in both blue and red states. And so if we, on the alternative, we can see what we could do if we have more support amongst the elected leaders to have greater support for funding for example, the Office of Civil Rights at the HHS, or the other mechanisms where we can have, if nothing else, anti-discrimination efforts, much less efforts to proactively deal with proactively deal with disparities and discrimination.
Yeah, Anthony, thank you. As I bridge, maybe going to Samantha next, let me just mention two things. You mentioned it starts with the money kind of question. And to your point, I know that Families USA has several resources that go to implications, not just for health services, but more broadly, you know, including healthcare affordability, as well as just tax policy, like the child tax credit. There's a question that came in from somebody about that. So I know that we're dropping in links for everybody in the audience to kind of look at some of the resources that Families USA has put together on enhanced tax credits, the prescription drug affordability, even the Finance Committee Inflation Reduction Act hearing, and fair hospital pricing. So there's some really great resources there that I think touch on your point, that it's about finance, about the money, and how we adjudicate these things. Samantha, you know, same question to you. You know, what are some implications and even some resources that you think could be helpful for health equity practitioners?
Well, I agree first wholeheartedly with Anthony about, you know, the impacts on financing, and that obviously has waterfall effects throughout what's going to happen. I think what I want to do is bring the focus back onto what happens to people and our communities. And I think What I'm going to say next is not going to be anything new to anyone on this call, but I think it's just an important reminder about how inequitable our systems and our communities remain today. So every year we do an analysis looking across, I think this year it was over 60 measures of health access and health outcomes. And there just persist these very stark racial disparities in people's experiences. So we see disparities in people's ability to get into the healthcare system, but we also see disparities in people's experiences within the healthcare system. And you can see that from a survey we conducted this last year on racism, discrimination, and health, with people of color being much more likely to express being mistreated in the healthcare system because of their race and ethnicity, feeling they have to be really careful about their appearance before they go to the doctor to be treated fairly, fearing that they're gonna have to have poor statements made to them when they're in the doctor's office. And then this all has ultimately impacts on people's health. And so there remain really large disparities, from birth to death, differences in life expectancy, differences in infant mortality. So this really does have real impacts on the health of our communities, and the sharp inequities there, as Daniel mentioned, that also translates into unnecessary costs in our healthcare system, and also more broadly in terms of lost productivity, shortened life expectancy. So there really are just such far-reaching impacts of these inequities. And what's at stake here is, I think, really what happens. Do these inequities continue to deepen and widen, or are there continued efforts to try and narrow them? And, I know there have been several comments in the chat about, are we just focused on healthcare? No, we're not just focused on healthcare. These inequities really do reflect parallel inequities that we see across the social and economic factors that we know drive health. And so differences in those factors are also going to have implications for health. The other point I just want to make is how all of this sits against the context of the history of policies in our country. And really, as we think about what might happen going forward, I think it's also important to recognize how the current environment and current situation has been created by a long history of policy decisions. And we also have a timeline available on our website at KFF that I think is very educational and kind of understanding how different policy decisions over time across sectors really do influence what we see in terms of health disparities. And so I'll stop there.
Samantha, I really appreciate that. I think at the outset of the call, I had mentioned that equity is in practice a means to be able to reveal otherwise hidden harms, and also the structures and policies that put people in harm's way. And I think the resources that are now being shared in the chat that you just voiced over from KFF, I think are additionally really helpful to be able to reveal those hidden harms, reveal the underlying structures, and to your point, reveal the intersectionality really of how those harms impact multiple sectors, including but not limited to healthcare. So really appreciate that. And that's maybe a great segue, Daniel, to you, especially the scholarship and the advocacy that you've done around the political determinants of health. Just curious what you think are implications and even some resources that practitioners could use to understand these issues and address them.
Thank you, Rishi. And let me just say, I'm happy that Anthony talked about the economic argument. I'm glad that Samantha said, let's pull it back and talk about, the lives that are affected. When I think about these issues, and thankfully we are now living in an age where we have been allowed to do the kind of epidemiological, whether social epidemiology or legal epidemiology research that enable us to understand the impact of politics and policy on the lives of people. And for me, the implications really are about both, right? So I'm glad those were highlighted. When you look at the evidence from the time that we had women's suffrage, the time that women were allowed to vote, looking back at the data, we can see now through that constitutional amendment that there was an increase of 15%, up to 15%, depending on the region of the country, for maternal health, infant mortality rates improving, and so forth. That's pretty exciting. When you look at it in the South, right, for African Americans, we know that laws such as the Voting Rights Act, the Civil Rights Act of 1964, the Fair Housing Act, led to significant improvements in life expectancy, in health outcomes. In fact, one that Nancy Krieger conducted back in 2006, that was published in 2006, found that between 1965 and 2002, almost 40,000 Black infant deaths were prevented because of those egalitarian policies. We know that equity-focused policies impact our health and our lives. They dictate how long we're going to live on this earth. And so it does matter. We know from recent research that I alluded to earlier that we did with the Deloitte Health Equity Institute, where we were crunching the numbers and projecting what it's going to look like as we become a more racially pluralistic society up to 2040. We know those numbers are going to increase significantly if we don't really rein in these costs now, right? So the fact of the matter, I know Deloitte just published another one, but we found that almost $14 trillion will be spent on disparities, just racial and ethnic alone, doesn't include disability-related disparities, doesn't include disparities related to older adults, our veterans, LGBTQ individuals, just racial and ethnic alone, is expected to cost $14 trillion. That's $42,000 per individual in this country. I want to also then go back to what you were saying earlier when we talk about the Supreme Court and the Chevron case. So we've been discussing the ways in which federal policies and decisions, affect health equity. And there is that recent Supreme Court decision. As a health law professor, it really, really concerns me about how this may play out in the future. So for those who are unfamiliar with the Chevron doctrine, it has been the cornerstone, of administrative law for decades. It gave federal agencies essentially the authority to interpret ambiguous laws within their purview as long as their interpretation was reasonable. So this was especially important in areas like healthcare and in public health, mental and behavioral health, environmental health, you name it, where agencies like HHS, CDC, EPA have expertise that is far beyond what the courts have. But with the Supreme Court, the recent Supreme Court decision, Chevron, basically striking down the Chevron defense, federal agencies will face greater scrutiny when they're interpreting laws and implementing regulations. And this shift is going to likely lead to more legal challenges and limit these agencies' flexibility in addressing complex health issues or complex policy issues, including health equity, as we've been talking about. So as an example, agencies that are working on critical public health initiatives, such as expanding Medicaid access, as Samantha articulated earlier, regulating environmental health hazards, or addressing disparities in healthcare delivery, will now have less authority to make quick and informed decisions. That's really important, right, to understand that. And instead, their actions will be more vulnerable to lawsuits and judicial interventions. Again, what's really ironic to me, Rishi, is that the Chief Justice Roberts, in the first case that was attacking the constitutionality of the Affordable Care Act, mentioned in dicta that judges did not have the policy expertise to, basically interpret many of these statutes, and therefore that's why it's left to these agencies, these experts in our agencies. Now, all of a sudden, he's taken a 180 along with the majority of the court on that through the Chevron decision. So I think at its core, each of these challenges undermines the political determinants of health, and it's something that we have to keep at the forefront as we're moving forward.
Really appreciate this. And I know in the last maybe 6 minutes before we leave some room for kind of some polls and kind of wrap up here, there are a number of really great questions. Some of you have actually addressed the questions directly in your responses here right now. Let me summarize some of the questions in the through line that I'm seeing here and ask this question, perhaps in lightning round style, maybe a minute each. What can we do? And to kind of frame this a bit more, I want to use the kind of one definition of kind of movements or social movements. Sometimes people think about these broad things, but social movements are really just purposeful, organized groups of people who share and work towards a common goal. So I'm curious if you can answer this question. What can we do? There's a lot of questions about what can we do in terms of how do we talk about this? How do we act on this? And I'm wondering if you could just take a pass at talking about what we can do, what the folks listening in today can do as part of purposeful organized groups that may exist in their networks, in their institutions, right? Or even more broadly in their community. Want to maybe turn this first to, let's go, Daniel, first to you and a minute, then Anthony, you a minute, and Samantha, you to kind of close us out.
Thanks, Rishi. So I think first we have to stay informed and engaged. I think we all need to be mindful of this myth of the zero sum, right? Recognizing that in this health equity movement, the reason why we were able to advance the needle forward the way that we have and made all of these gains in this fourth period of awakening around health equity is because we harnessed the power of collaboration. We recognized that there are different dimensions to health equity. And by not allowing, opponents or the forces of ill will, as Dr. Martin Luther King Jr. called them, to, create division within our ranks, I think that will help to continue to set us on the path forward and ensure that we realize even more successes moving forward.
Daniel, thank you. Anthony, to you. And you also mentioned earlier about C3, C4, like, the freedom to discuss the past, et cetera. Just welcome your thoughts.
Yeah, I mean, I think, and I like how Daniel ended there, because I do think that there is a story of hope here. He talked about how all these infant deaths were prevented because of changes in policy. But, we have a story of what happened with the Affordable Care Act and how many more people are covered and how many more people are getting care as a result. We can show that progress is possible, and I do think that if we can. The folks on this call are trusted in their communities. And so you have, I think, not just a role, but an obligation to be, to talk in your community about the election, not in a partisan way. I understand what restrictions exist, but, frankly, voting is actually good for your health. There's data that backs that up, that civic engagement, voting, being part of communities is good for your health. And so just having a message and an effort to just encourage engagement, even in a nonpartisan way, is positive. Having anything that just raises healthcare issues as part of the campaign conversation is positive. Having that hopeful message about what can be rather than what you should fear. If this election is about the border and crime and whatever, versus if it's about the hopeful message of what can be done with regard to health, you all are trusted messages in the community that can get that message out. In a nonpartisan way, if necessary, to do what is necessary to at least instigate those positive and proactive parts of our brain and of our civic life. And so I just want to offer that. We have a What's at Stake toolkit in the chat, in the link, that provides resources for health advocates and community advocates to take advantage of. Some of those are links to some of our partners like KFF, but the point is that there are ways to be engaged, even in a broad way, just to say our health is on the ballot, that and leave it at that, even if that's necessary.
Thank you. Samantha, last but not least.
Yeah, I think I'll try and combine some of the points that were made by both Daniel and Anthony. I think even separate and apart from the election, just thinking about how we continue to make progress forward on addressing disparities and advancing health equity, I would just make the call to lead with data. And in order to do that, we need to collect and do the research to be able to show the impacts of different approaches, different interventions to address the ongoing gaps. So, I think, as was mentioned, there are a lot of positive stories we can tell from data about how we have made progress and how that progress impacts people's lives, as well as people's finances and our country's economic situation. I also think Daniel's point about it not being a zero-sum game is really important. Don't just talk about and use the data to show how there's been progress for certain communities. This progress helps improve the health and economic stability of our nation overall. So we're really talking about improvement for everyone when we narrow those gaps. And the last plug I'm really going to make is really the importance of engaging community when we are collecting these data, when we are doing this analysis, when we are reporting these data. I think one of the most important lessons I think we can learn from COVID is the knowledge and strengths that lie within community themselves. So when outsiders come in and try and implement solutions to problems, they often don't work because they have not taken into account the knowledge and strengths that lie within the communities themselves. And so I think anything we can do to help elevate, bolster, support that strength, those and that knowledge is going to be really important moving forward.
Samantha, thank you, Anthony and Daniel. I think in the chat I'm getting freedom to ask maybe one quick question, purely lightning round. And it speaks to something that each of you have alluded to in terms of hope or fear and the underlying kind of resource that we can't squander, which is our emotional resilience, our drive to kind of do this work, their energy and the hope. So I'm actually curious if one of you wants to take this question, which is, when it comes to the actions that you're recommending, which is to learn more and use data, to be able to join with others and to use our voices in different ways. How do you, each of you, as the really vanguards and some of the rock stars in our kind of health equity movement, as I see it, how do you find sources of hope or emotional resilience? And how do you recommend others find the same thing? Where do you find hope is the question. Let me go to Anthony, Samantha, and Daniel.
I mean, I find hope in the progress when in the fact that we actually have made real progress. I don't think that the message is about the crisis and everything is doomed. That makes people feel, okay, then maybe I should just protect what I have for me and my own, and as opposed to one where, yes, actually some of these community solutions are better. And as Samantha said, our system is stronger when everybody's included. And but like what gets me up in the morning is when somebody is getting care and not having to deal with a bill afterwards, or somebody is actually getting the preventative care so they don't have to actually show up in the ER in the first place. So that's my answer.
I'll just add to that the idea of progress, because as a scholar of history, when you look back, we have the luxury of looking back. And when I look back and slice and dice history, when I look at the 4 periods, as you heard me mention, right, the first time that health equity champions got to realize a pretty equity-focused policy under the Lincoln administration, how it took 100 years later, but we got the civil rights movement in this country, and health equity champions were able to integrate and address the overt forms of discrimination to the point where we were talking about disparities or inequities in health status, to where we are now, where we're talking about structural level interventions, right? Again, to move that needle in a more meaningful way. This is pretty exciting to me, to be living in this day and age where we know that every time we have tried to move that needle, there's always this retrenchment, this backlash that comes up. We expect it. And yes, it is painful, but there's no denying we're making progress. And that's why you see the opposition intensify. That is what gives me hope. The other piece that gives me hope is our young people today. I love this generation. I have the luxury of working with brilliant scholars as you do, Professor Manchanda, and they give me hope every single day. I listen to them. They're a force to be reckoned with. They're unapologetic about moving our nation closer to achieving health equity. And that for me excites me. It puts me to rest every single night knowing, you know what, we have folks who are ready to take that mantle and move us forward.
It's hard to add on to what they've already said, but I will say I think it is looking at the long game and finding incremental wins. And if you want really a great example of that, I mean, look at the world pre-ACA versus post-ACA. And there has been a huge shift in terms of coverage, which has meaningful impacts on people's ability to get care, in terms of protections for consumers. I think memories are short, and it's hard for people to remember what it was like before those policies were in place. And so I think finding those concrete examples of where we've seen real shifts and real change, some of them are larger, some of them are more incremental, some of them are more conceptual, as Daniel was pointing to some of just the language and what we believe about what drives inequities. But I think there are wins to be found, and it's important to continue to look for them.
Samantha, thank you. Let me turn this back over to Jacqueline to kind of round us out. My deep kind of gratitude to each of our panelists here today. your answers, and for everybody's in the chat as well. There are folks who are at the beginning of this thinking about how to get involved. There's folks who are, as you can see in the chat, also calling for civil disobedience or for being prepared to kind of do large scale kind of social movement work. Wherever you fall on the spectrum, collective, deliberate solidarity, I think, is the answer. And I think Jacqueline's going to show us a couple opportunities to continue the dialogue.
Yes, thank you so much, Rishi. Thank you, Daniel, Samantha, Anthony, for your incredible insights today. Whenever we have a powerful discussion like this, we're always up against the clock. So thank you for those of you who are hanging on with us. We are going to wrap this up. As you see, there is a poll that just popped up, and we would love to get your feedback on that form, as well as the evaluation that comes up afterwards. One thing I definitely want to mention is that we do have a webinar coming up on October 22nd, which is understanding legal attacks on racial health equity programs. I know many of you had questions about, what about my funding, right? And those, what about, should I be concerned about being at risk? And those are some questions that we want to answer when we have our partners from the Legal Defense Fund come and talk to us from a more legal perspective, right? Today, our speakers really got into talking about some challenges at the federal, state, and local levels, some stark differences about presidential candidates' platforms, right? And I'll just say, in the words of Anthony, I have many Anthony quotes today, but healthcare, and I'll add health equity, is on the ballot, right? And if nothing else, remember that voting is good for you, right? And so, those are just some things that we heard today. I know I'm leaving with a lot to think about. I hope you are too. And I really just want to thank everyone for being here, for your thoughtful questions. Again, before we wrap up, I do want to invite you to just share that link to the webinar, and hopefully we'll see you there next time. Thank you, everyone.